B. Simple columnar.
Ijoma is not even thinking about this. Like,
I'm sure.
you're very sure of this.
Yes.
So in the intestines, you have simple columnar. Is that your final answer?
Yes.
Congratulations, you are correct. All right, guys. So you're welcome to the second edition of the anatomy quiz. So in the first edition, we had Vera and Jessica who trashed 19 out of 20 questions. So for today, we have new guests, and they've done so much research about the digestive system, so much research on the digestive system, and they are ready to trash any question that comes their way. So without wasting much time, I want them to introduce themselves.
Good day. I'm midwife. One boy Joma.
Hello guys, I am Deborah, I'm a student midwife.
Okay, Ijoma and Deborah, you're welcome to the second edition of the anatomy quiz. Let me ask, on a scale of 1 to 10, how ready are you for this quiz?
10 over 10.
10 over 10?
Yeah.
Are you serious? 10 over 10?
Yeah.
Yes.
Wow, that is so much confidence. Deborah,
We're very prepared.
is it 10 over 10 too?
10
Yes.
over 10, yeah.
Wow, that is so much confidence. That is overconfidence. Anyway, let's prove that. Let's prove it. So without wasting much time, let's move to the first question. So we have a system with us, and we're going to be reading the questions from the system. So every question is about 30 seconds or less, 30 seconds. So number one question. The following are gastrointestinal tract organs except liver, stomach, duodenum, cecum.
A, liver.
A. Liver.
Liver.
Yes.
You're not even thinking of this. Like, is that how prepared you guys are? Like 100% prepared. Liver, is that your final answer?
Yes.
The correct answer is liver. Congratulations. Number two, which of these is not considered an accessory digestive organ? We have tooth, tongue, gallbladder, stomach.
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 Yeah.
Ijama, are you on the same page? Which of these is not considered an accessory digestive organ?
D.
Stomach.
Yes.
Is that your final answer?
Yes.
The correct answer is stomach. You are correct. You are correct now. You are correct. So, all right, number three.
Okay.
The following are specialties in the digestive system except urology, gastrology, gastroenterology, dentistry. So which is not a specialty?
A, knowledge.
Are you?
Are you sure of that?
Yes.
You are free to choose a different answer.
I take D.
D, dentistry.
Yes.
Final answer.
Yes.
So, Deborah, do you want to change?
So, like,
Which is not a specialty
I
in the
think
digestive system? Which of these specialty does not deal with the digestive system? That's what I mean. Urology.
Yeah. Very
Final answer.
100%. You just like that.
Ijoma, do you want to go with her, or you still insist on? No, you're free to have different answers. You're free to have different answers.
I choose D.
Dentistry.
Yeah.
Final answer, dentistry for Ijoma and urology for Deborah. Okay, so the correct answer is not gastrology, and it is not gastroenterology.
Okay.
So it's between urology and dentistry.
Good, right?
Do you want to change?
No.
All right, so the correct answer is actually urology. So dentistry is about teeth, like it's about teeth and oral cavity. So it's still about the digestive system, but the urology is about urinary system, especially male urinary system. Yeah, that's what it is. So it's not about digestive system. All right, let's move to the next question.
Oh my God.
Okay, number 4. Which of these salivary glands is farthest from the oral cavity? Sublingual gland, submandibular gland, parotid gland, buccal gland. You have enough time to think. C.
Yes.
Like you didn't even think about that. Are you sure? Are you sure it's C?
Yes. C. C.
Something like close, like buccal is close, so it's parotid.
Okay, it's parotid gland.
Yeah.
Final answer.
Yes.
Anyway, you're correct. So the correct answer is parotid gland. So the parotid gland is actually found close to the ear, so they are farther from the oral cavity compared to others. All right, number 5. Which of these glands secrete ptyalin? Parotid gland, Brunner's gland, gastric gland, intestinal gland.
The okay.
D,
Yeah.
intestinal gland.
Yes.
Ijoma, are you on the same page?
Oh my god.
You're free to choose different answers.
I'm still contemplating. Parotid.
You know what is Bruna?
I don't know what is going on.
Choose the one you know.
Okay.
You have 5 seconds to do so.
I choose the other two.
I choose D.
Okay, you're going with D. Intestinal gland,
Yeah.
secrete xylem.
Yes.
Final answer.
Yes.
The correct answer is not Brunner's gland, and it is not gastric gland. Unfortunately for you guys, the correct answer is parotid gland.
Thank you.
Xylem is salivary amylase, and
Jesus.
it is secreted by the salivary gland. So the only salivary gland that is there is parotid gland. Okay, so we're going to move to the next question, number 6. We have 14 questions to go. The innermost layer of the GIT, of the gastrointestinal tract, is called mucosa, submucosa, muscularis, adventitia.
A. Mucosa.
A. Mucosa.
Mucosa.
Yes.
Actually, I'm not going to fail this also.
Not at all.
Final answer, mucosa.
Yes.
Mucosa.
You're correct, you're correct. So mucosa is the innermost layer of the gastrointestinal tract. Number 7, the epithelial layer of the gastrointestinal tract is mucosa, submucosa, muscularis, adventitia.
The submucosa.
Submucosa,
Second,
epithelial layer. Final answer,
no, it's mucosa.
mucosa. You're having different answers.
I don't know. It's mucosa.
Mucosa, how sure are you?
We need to just give us time.
You still have 10 seconds.
It's mucosa.
Ijoma, do you want to change? Are you still with submucosa?
Yes, I'm submucosa.
Deborah, are you sure you guys do not want to talk to yourself? Okay, so the final answer is mucosa. So mucosa is actually the correct answer. The mucosa is the innermost layer of the gastrointestinal tract, and that is where you have epithelial tissues. Number 8. Which of these is a feature of an empty stomach? Ridges, rugae, cavities, caries.
B.
B, rugae. Don't want to think about that.
No, it's okay.
Rugae.
Yes.
Final answer, rugae.
Yes.
You're correct. So rugae is, so when the stomach is empty, it is thrown into folds known as rugae. Okay, number 9. The epithelial tissue in the anal canal is simple squamous, simple cuboidal, keratinized stratified squamous, non-keratinized stratified squamous.
D. Non-keratinized stratified squamous.
You have to be very careful. You have to be very, very careful. Is that the answer?
Yes.
That's the answer.
Final answer.
Sorry.
All right, you're correct. So the epithelium in the anal canal is non-keratinized stratified squamous and is protective in function. Okay, number 10. Chemical digestion of starch begins in we have mouth, stomach, small intestine, large intestine.
No.
Mouth.
Yes.
Ijoma, you've not said anything.
No.
Mouth.
Chemical digestion of starch
Yes.
begins in the mouth.
Yes.
Yes, mouth.
Final answer.
Mouth.
You're correct. So, which of these processes moves food along the esophagus? Peristalsis, gravity, reflux, compression.
A.
Peristalsis.
Yes.
Final answer.
Yes.
Don't be too sure. You have to think about this.
Yeah.
100%.
Yes.
You're correct. So peristalsis is actually the rapid contraction and relaxation of the muscles along the esophagus, and that moves the food down to the stomach. Number 12. The movement of nutrients into the bloodstream is termed secretion, filtration, absorption, secretion. I think this is going to be tough.
It's
C,
Movement of nutrients.
yes.
movement of nutrient. Like you have to read that again.
It's
C, Ijoma. Let's wait for Ijoma to come to 10. You are free to choose a different option. Question is tight. Ijoma, don't be overwhelmed. You can choose anything you want. You can choose anything you want. You still have 5 seconds to make up your mind. Hmm.
A.
Secretion.
Yes.
Final answer, secretion.
Yes.
And absorption.
Yes.
Are you sure you want to choose what you
No.
choose? Okay, so the correct answer is not filtration. And it is not secretion, it is absorption. So absorption is actually the movement of nutrients from the digestive tract, from stomach and intestines into the bloodstream. So that's what absorption is. What part of the GIT forms vitamins? Esophagus, stomach, small intestine, large intestine. Still have 10 seconds.
No.
And you guys should be louder when you want to.
I think C.
C,
Yes.
small intestine.
Yes.
Ijoma, what are you choosing? You should choose B. Like, are you supposed to choose different options? What part of the GIT forms vitamins? You still have 5 seconds to make your mind.
I think it's C. I don't know,
C, small intestine. Is that your final answer or you want to change?
C, Sha.
Okay, so the answer is not esophagus and it is not stomach. It's between the intestine, the large and small intestine. So that means it's C. Unfortunately for you, it's D. It's large intestine. So vitamins are formed in the large intestine. So that's why you have all these bacteria, all these normal flora. So they're the ones that actually helps in the formation of feces and the formation of vitamins. So it's actually the large intestine. What portion of the pharynx receives food from the mouth? Nasopharynx, oropharynx, laryngopharynx, cricopharynx.
B.
B.
Yes.
Oropharynx. Like you didn't even
No,
think.
no,
No, you have to wait. I have to wait, please. What do you think about it? Oropharynx. Final answer, oropharynx.
Yes.
You're actually correct. So, what portion of the pharynx is not part of the digestive system? Nasopharynx, oropharynx, laryngopharynx, cricopharynx.
A.
Nasopharynx.
Yes.
You're correct. So that's the correct answer. Nasopharynx is not part of the digestive system. Where is chyme formed? Oral cavity, stomach, small intestine, large intestine.
B. Stomach.
So chyme is formed in the stomach.
Yes.
Deborah,
Yes.
are you sure you don't want to choose a different option?
It's obvious.
It's obvious. What makes it obvious?
Not like me. Like
Secretion of
body
the
of-
gastric juice.
yes.
Which
Okay, gastric juice, mixture of gastric juice.
of gastric.
Anyway, it's all right. You're actually correct. Congratulations. Let's move to the next question. Absorption of nutrient begins from stomach, small intestine, large intestine, esophagus.
B, small
Small
intestine.
intestine.
This small intestine, where it begins from.
Yes.
Final answer. Final answer.
Yeah.
Yes, small intestine.
Small intestine. So the correct answer is stomach. So that's the absorption of nutrients. You are looking at me. So absorption of nutrients begins from the stomach. So you have some absorption of vitamins. You have absorption of fat. You have fat-soluble vitamins. You have absorption of water. You have absorption of alcohol. They all begins from the stomach. So that's how absorption begins. Number 18. The cricopharyngeal sphincter is a feature of the esophagus, stomach, small intestine, large intestine.
Esophagus.
Esophagus.
Yeah.
All right, you're correct. So let's not waste time on this. 19. Salivary amylase from the mouth is deactivated by pepsinogen, pepsin, hydrochloric acid, alkaline mucus.
C. Hydrochloric acid.
Are you sure you're not going to fail this?
No.
Are you sure you don't want to think about it?
No.
So final answer, HCl.
Yes.
Correct, you're correct. So HCl deactivates salivary amylase. Okay, so we have one more question to go. Number 20. How many molars are in a normal adult dentition? We have 6, 9, 12, 15.
C, 12.
Molar.
You have 10 seconds.
We have 30. I choose C, Sha.
We have 5 seconds left. Ijoma, we're waiting for you to make your choice. Your time is almost over.
I choose C, Sha.
Are you going with C? Is that coming from you, or you just want to choose the C? Is that coming from you? So final answer, C,
Yes.
12.
Yes.
Unfortunately, your final question, you can imagine that. Unfortunately, you are being unfortunate in your final question.
No, can we make
No, you can't make any adjustments. Adjustments. So unfortunately, the correct answer is C, 12, which is correct. So you're actually correct. So you have 3 at the you have the upper teeth. The upper teeth you have 3. You have 6. That is 3 at both sides. Then in the lower teeth you have 3 at both sides. So altogether 6 up and 6 down, making them 12. Okay, so thank you so much for coming to this show. And for our audience, if you learned something from this show, you can give us a thumbs up by clicking on the like icon on your screen. And if these are the kind of videos you would like to watch, make sure you subscribe to this channel and hit the notification button. So thank you so much, and see you in the next video.